Hi guys, this is Nandini at Surviving Medical School 101 and welcome to the very first video of the pre-medical series. Today we are going to be talking about the first step in your journey to medical school, which is making the decision to become a doctor. And I can't stress how important it is to consciously and internally make this decision. I have met many students who prepare for their pre-medical entrances without having any idea of why they are doing this, without knowing why they want to become a doctor. This is counterproductive because unless you're sure of your decision, you're not going to have the motivation and dedication required to undertake this journey of getting into medical school. And so, in my opinion, making this decision and making this decision for the right reasons is half the battle won. So why is it that you want to become a doctor? Whenever I ask pre-meds this, a very common and cliche response I get is because I want to help people. And this makes me cringe on so many levels. Come on guys, you're not even 20 yet. Stop thinking about others. Focus on helping yourself first. So if this is the sole reason that you want to go into medical school, I would strongly urge you to reconsider your decision, because in my opinion, any field that you go into, if you love what you're doing and you're good at what you're doing, you are going to be helping people. Your decision to go into medical school needs to be a lot more than just compassion. Of course, that is very, very essential, and that is a huge component of being a doctor, but that should not, in my opinion, be the reason that pushes you to medical school. So whichever stage of preparation you are in, I would suggest that you guys take a step back and honestly answer the following questions that I'm about to discuss before you make your decision of getting into medical school, because in order to make an informed decision, I believe it's very, very important to know both sides of the story. So I think the first thing that you need to ask yourself is that, do you love the subject? Does the human body fascinate you? Is it something that you can envision yourself studying and learning about and working with for the rest of your lives? Because if the answer to this is no, then obviously medical school is not going to be the right choice for you, and you should look at fields and subjects that actually interest you. However, if your answer is yes, fantastic, medical school might be a great option for you. However, I would just like to remind you guys that just because you like bio does not mean that the only option you have is medical school. There are a lot of other fields related to bio, such as dental school or pharma or zoology, botany. So I think this is loving the subject and being passionate about the subject is a huge factor that should influence your decision. However, it should not limit your decision. Explore all your choices consciously, find out about the other opportunities that and other fields that are out there related to bio before you finally decide that med school is right for you, or maybe it isn't. The second very important factor that I think should influence your decision is knowing whether you're the type of person that can study and learn all their life. Because medicine is like an academic treadmill in which once you get on, there is no getting off. You have to constantly learn and evolve and keep updating yourself even after you complete your MBBS, after you complete your specialty, your super specialty, and so on and so forth. Let's say 10 or 20 years down the line, when you're an established physician or an established surgeon, the learning would never stop. You would keep having to update yourself and evolve your practice and your skills in order to be able to keep up. So I think it's very important for you to ask yourself, are you the kind of person that genuinely enjoys learning and can see themselves doing it all their life? The third factor that should influence your decision of coming into medical school or not is knowing whether you're the type of person who can make their work and their profession their whole life. Because guys, being a doctor is never going to be a 9 to 5 job. Are you the kind of person who is willing to compromise on your family life and on your social life and on other aspects of your life for your career? I think knowing this is very, very important, because trust me, it's gonna get much worse before it gets better. Right now, medical school is hectic. We have classes, we have clinical rotations, we have labs, and all of that is hectic. And you feel okay, once medical school is over, it's gonna get better. That's not true. As soon as that's done in your internship or your residency or fellowship, you're going to have 48-hour shifts, 100-hour weeks, and it is going to take up all your time. Your life would be all about your work. And if you're not the kind of person who's okay with that, if you do want a healthy family life or social life, then I think this is something that you really need to consider, that this is a career and this is a profession that makes certain demands of you that you would have to fulfill eventually. And if you don't think that you can, then maybe consider some other field. The fourth question that you need to answer is that, is dealing with sickness and illness and death on a regular day-to-day, hour-to-hour basis something you're comfortable with? Do you think that that is the kind of life you want? And is that gonna fulfill you and make you happy? This is where I think your compassion comes into play, but I believe this is much more than compassion. Of course, when we see someone who is ill or someone who is dying, you are sympathetic towards them, you feel bad. But this is more than that. You would have to keep your feelings aside, be strong enough mentally that you keep all of those feelings aside and are able to be in an objective frame of mind so that you can treat them. Because as soon as you get subjective, your diagnosis, your treatment is going to get affected. So I think it's very, very essential that you know whether mentally and psychologically this is something that you can handle. And it's okay, it's not everyone's cup of tea. So many people have dropped out in second year of medical school because they are not able to deal with it. So I think it's very important that you ask yourself these questions from day one and you're prepared for it. The next important factor you need to consider is money. Is earning big bucks your motto in life? Is that what you really want to do? Because guys, if that is the case, then trust me, there are many other fields out there in which you have much less struggle, it's less tough, much less difficult, and you're going to be earning much more quickly. So I think if that is the factor that motivates you to get into medical school, that doctors earn a lot, trust me, that's not true. To get to a stage where you're established enough that you're earning a lot takes a lot of hard work, a lot of struggle, a lot of pain, and medicine has a lot of rewards. Money honestly is not the biggest of them. So if that is a driving force for you, then there are much easier fields that are going to give you the opportunity of earning much more. And the final most important factor that you need to question is, are you being pressurized into this, or is this your own decision? Guys, when I talk about pressure, it could be a direct pressure from your family or friends telling you that this is something you need to do, or it could also be an indirect pressure from a mentor or seeing someone who is a doctor and seeing them being very happy and fulfilled in their career and thereby wanting to do this. You need to realize that the only way medical school is going to make you happy is if you genuinely want to be a doctor, if you genuinely want to do this, want to study for the rest of your life, if you are fascinated by biology, by the human body. Not if your friend or your family wants you to do this, or if they are doing it. So I think it's very, very important to ask yourself if this is truly your own decision, because I think that is something that many people go through. They're forced into it and it never ends up good. It's not gonna magically become something you love if it isn't already. So I think it's very important to know whether this is your own decision or it is influenced by somebody else. Now, I know many of you would be thinking why I'm being so negative and repeatedly asking you to reconsider. Guys, I consciously chose medicine as my profession, and I cannot tell you how fantastic that decision has been. Being in medical school, doing this is the happiest I have been in my life. And that is only true because I made this decision without any external pressures and for all the right reasons. I knew what I was getting into. I genuinely love the subject. I can envision myself studying and learning all my life. That is not something that is a con for me. In fact, that is something that is a plus point for me. And being around sickness and death, again, it's something that I know I can handle. So I think the only reason why I am so happy and satisfied with my life right now as a medical student and a doctor to be is because I made this decision for all the right reasons, and I made this decision. Nobody else made it for me. And I think that is what is very, very important. I have seen so many students coming into med school with either a disillusioned image of how it's gonna be or because they were forced into it. And trust me, it never ends good. They either end up becoming depressed and frustrated with life, or end up dropping out, or in extreme cases even commit suicide. So if you think that medicine is not the right choice for you, guys, please do not force yourself into it. Nothing good can come out of that. Medicine, for all its rewards and amazing perks, is a really difficult path, and it is not meant for everyone. And changing your mind or reconsidering or deciding to, change your course, that does not make you a failure. That does not make you a quitter. That might be one of the best gifts you give yourself. However, if you are one of those special kind of crazy who is fascinated by the human body, who does not mind the long hours or the ginormous textbooks or being around illness and death all their life, then med school is just the place for you to be. So that is all for today, guys. Step 2 in the pre-medical journey is going to be posted in 5 days, unless we can cross 100 likes on this video, in which case it would be posted immediately. So give this video a thumbs up and do not forget to click on the subscribe button so that you can get notified every time I post a new video. Thank you so much for tuning in, guys, and I'm gonna see you in the next one. Have a great day.